Hello and welcome to this episode of Let's Talk About by Kangaroo. I'm Vedika and today we have with us Dr. Roshan Bhad. Dr. Bhad is an Associate Professor of Psychiatry at the National Drug Dependence and Treatment Center at the All India Institute of Medical Sciences. Dr. Bhad is also on the board of directors of the International Society of Addiction Medication, as well as he heads their NEXT program. Dr. Bhad completed his post-graduation in psychiatry from AIIMS and developed an interest in addiction medicine during his clinical work within community settings. His areas of interest for research include addictive behaviors amongst adolescents and youth, community-based addiction psychiatry, consultation liaison addiction psychiatry, drug policy, and public health. Our conversation with Dr. Bhad today is going to center around relooking and rethinking the way we look at addiction as well as substance use. Before we begin, however, we would like to put out a trigger warning for our audiences. If at any point during this conversation, should you find yourself feeling triggered or distressed, we urge you to take a step back and look after yourself. Should you need any additional support resources, you can also find them on our website. And now, without taking much time, let's hear more from him. Dr. Bhad, welcome to the episode. It's lovely to have you with us today.
Thank you, Vedika, and I am pleased to be here. And I'm happy to be part of this dialogue on substance use disorder with Kangaroo Minds.
Thank you, Doctor. I know you've been so pivotal in the work that you've done, as well as in supporting people, who are coping with an addiction. So, before we get into more on this topic, for our audiences, can you throw a little bit of light on, the various types of addiction which exist?
Okay, so basically addiction, we can actually start with what addiction is basically, and then we can actually see what are the types, because there are a lot of misconception about the addiction as a concept. Many times it is considered that addiction is kind of the choice by the patients, or it is done by patient, or those who are using various substances, they are using it deliberately. And sometimes it is also considered as a curse, or sometimes it is considered as a immorality or moral issues as such. But the current understanding is addiction is a disease, it's a brain disorder basically, and it also has a psychosocial component. So and the various types of addiction which are involved, so it is there could be the chemical addictions, and there could be the non-chemical addictions or behavioral addictions, which is mainly the classification. And in chemical addiction, the commonly seen addiction is most commonly we are using tobacco. In India, it's a tobacco and alcohol, which are also legal. And among the illegal drugs, it is cannabis, opioids. Then there is a cocaine, which is a stimulant. Then there are the hallucinogens, and then there is a amphetamine type stimulants, which are also again stimulants. And there's a inhalants, which are very routinely used products in your household, and which is commonly used by the kids and adults and age group. So there are various types of addictions are there, and only thing, it is available, it is present everywhere actually. If you go to India, in most of the all of the states, the addiction is there. Only thing, the nature of problem varies from state to state, and that is true also about the global thing. If you globally also, the addiction is everywhere. So some countries the behavioral addiction is more, some where chemical addiction is more. In chemical addiction also, some countries alcohol is a major problem. In some countries opioid is a major problem. So there could be the varieties, but it is the global phenomena.
Right. So, Dr. Bhad, you've thrown a little bit of light on a few things which I'll come to later in our conversation. But speaking of addiction, what are some of the risk factors towards developing an addiction or a substance use related problem?
Yeah, so see, adults, the addiction usually start at very young age, and so there are many risk factors which could be there. One of the risk factors could be divided. We can divide it into the modifiable risk factors and non-modifiable risk factors. So some of the risk factors, if there could be genetic risk factors. So if there's a family history of substance use, or somebody in family who's using substance and already suffering from substance use disorders, then their children or kids are more likely to have the problem with addiction. And there's a genetic risk factor which is been proven by the various research studies. So, and it is a non-modifiable risk factor, right? So then there are other risk factors, like there could be the factors like a parental supervision. Then there could be the parental substance use, parental abuse. Like there could be history of physical abuse or even sexual abuse that could lead to the substance use in a subsequent life. Then there could be the problem which could be related to the school related problems. So there could be the problem with the adjustment in the school. There could be the peer pressure from the other school children who are using drugs or exposure to the drugs. There could be the poor academic grades and conflict with the teachers that could be also lead to the initiation of substance use problem. Then the another major risk factor is psychiatric morbidities. So there are a number of psychiatric comorbidities which could lead to the onset of substance use disorders. For example, in childhood conduct disorder or ADHD, which is the attention deficit hyperactive disorder, that could lead to the starting of substance use by the adolescent child. Then there is also uh, another comorbid illness like depression or anxiety disorders, and some personality disorders like antisocial personality disorders or borderline personality disorders. They are also very commonly associated with the substance use disorders. So we have to also look for these risk factors, and these risk factors could be actually treatable if identified early and treated by the specialist.
Right. So, Dr. Bhai, you put a lot of light, and I know at the beginning of the conversation, you did mention that, addiction is a psychosocial issue as well. So when we're talking about risk factors, like, did you see an increase in substance use or, any additional cases of substance use and addiction during the pandemic?
Yes, definitely. Because COVID has not affected individuals, but it has also affected us as a group, and there is a huge impact on society. And as I told you earlier about the biopsychosocial nature, so there is a definitely biological factor, then psychological factors which is related to individuals, and then there are social factors. So what has happened that because of the lockdown, there was a increase in loneliness, decreased interaction with the people, which is lead to the free time, and that has also led to the increase in consumption of alcohol and other substances or tobacco by many individuals, and which has increased in consumption or even the starting the substance use. So that was the one major thing which we noticed. Apart from that, there was an increase in screen time, and which also led to the increase in internet use, and then increasing engagement in the gaming disorders or gaming behaviors or gambling phenomena, which further result into the gambling disorders or gaming addiction. So that has also increased because of the COVID-19. Another major impact which COVID-19 had was impacting the treatment seeking and the treatment provision. So because of that, what has happened because of lockdown and serious restriction, many of the treatment centers were closed, or they were the patients could not get access to the treatment, and there was a decreased access, and because of that also the severity of problem and complications increased during the COVID-19 pandemic. So COVID-19 pandemic has actually impacted substance use disorders in a various domains and various dimensions.
Right. So, Dr. Bhad, what are some signs, of addiction that you would say that, we can look out for, or what are some common symptoms that are seen in, cases of addiction, whether it's behavioral or, chemical-based addictions?
Yes. So basically, this is very important question, and many of the audiences who are attending this conversation, they might come across the people actually who just started using substance use, or those who have already developed the addiction. So how to identify, or what are the red flag or what are the signs? It's very important. Particularly, this is important for the parents and teachers who are likely to see kids, adolescent or students usually going into the substance use. First time they are taking substance use, or just begin to start using substance use. So there could be some changes. For example, it is definitely lead to the behavioral changes. So the way person behaves, so there could be the changes in the behavior, like person can become more irritable or angry, or person can actually become more isolated or not talking to somebody. Okay, then there could be the other behavioral changes like the impaired self-care, or decreased focus on the studies, not giving concentration, decrease in attention concentration in the studies or the work. That could be also the early sign. Then there could be the obvious sign, like physical sign could also be there. For example, if somebody started using inhalants, you can see the some signs, like there could be the redness of the eyes, there could be the glossitis, or there could be the scar marks, there could be the smell related to the peculiar inhalant used by the particular individual. Similarly, alcohol also can cause a redness of eyes, can cause a irritable or aggressive behavior, and can also lead to the alcohol smell in the breath. Similarly, that can also happen with the tobacco consumption, and that can be also easily identified with the smell in the breath. Cannabis can also lead to the redness of eyes. So these are some of the physical signs which could be, if noted, should caution the family members or teachers that there may be actually starting up substance use, or person may be, exposing. So just to be cautious and just to identify early.
Right. So, Dr. Bhad, you've thrown some light on, what are the risk factors towards developing addiction, as well as what are some signs that we can look out for. And one of the things that you did mention was that, like certain mental health conditions can lead to addiction or substance use. But can you throw a little bit more light on, the vice versa aspect, which is how addiction and substance use can impact our brain as well as our mental health?
Yes, definitely. So this is, of course, it is a two-way relationship. Not only psychiatric disorders lead to the substance use problem, but substance use problem can lead to the not only psychiatric problem, but also physical problem as well. So regarding psychiatric problem, it could lead to the depression. It can cause the psychotic disorders. It can lead to the anxiety disorders. It can also lead to the sleep problem. So there could be the chronic insomnia in some of the persons who are using substance use chronically, right? And there could be the other behaviors like continuous aggression or irritability. That behavior can also be there, and there could be change in personality per se on the long-term use of substance use. So that can also be obvious, those who are using substances for a very long time.
Right.
So these are the some of the psychiatric morbidities which could be secondary to substance use. One classical example is actually cannabis-induced psychosis. So cannabis, heavy use of cannabis, or ganja or bhang, which is known in Indian language. So that can lead to the increase in dopamine level and can lead to the triggering the psychotic symptoms and psychotic disorder per se. It could also lead to the schizophrenia, and that is one of the major risk factor for starting substance initiation of psychosis, those who are using it for long duration of a period.
Right. So, talking about all this, what would be some of the treatment options that are available to someone who's having, a problem related to addiction or substance use?
Okay, so it is a biopsychosocial problem. So the treatments are also biopsychosocial. So biological means there are medications available, and there are various interventions available which can be done. Psychological means there are psychotherapies and counseling, and social means there are social support and the counseling technique which involve the social networks. So then there are self-help groups also, which also take care of the social part. So coming to the pharmacotherapy, there are a number of medications are available now. A lot of research has been done, and a lot of new developments has happened over the period of particularly last 50 or 60 years. Now we have a lot of medications to treat, particularly the medication targets craving part and withdrawal part. So most of the major addictive disorders have now medications which could take care of the craving or withdrawal symptoms, and can make the detoxification very comfortable and safe for the patients. So initially, when the medications were not available, the detoxification was a very painful process, and many of the people actually suffer a lot of morbidity and even mortality during the detoxification phase itself. But now with the availability of a lot of medications which are very effective and help us to wean off from the drugs comfortably and safely, the patient can undergo detoxification safely. So that is a very major change which has happened in the past couple of decades. Then there are medication for treating craving, for example, alcohol, and for opioid also. Then there is a medications to treat other using the other mechanism like deterrent agent. So, for example, disulfiram, which is used for the treatment of alcoholic disorder, is also very effective medication, and it helps as a deterrent agent for using alcohol. Then coming to the psychological treatment, so we have a lot of psychotherapy techniques which are developed over the period of time. So common one is uh, cognitive behavioral therapy, which actually targets the automatic thoughts or dysfunctional thinking, and then it also focuses on the behavioral changes. So that is, so using the principle of CBT, we also practice relapse prevention therapy, which is a type of CBT where the focus is on prevention of relapse, because relapse is a very important part of substance use disorders, and many of the patients actually go into relapse, and then again they stay abstinent and then again go to relapse. So there is a it is a relapsing disorders, or it's a chronic relapsing disorder. That is how it is classified, similar to other non-communicable disorders like hypertension or diabetes, or multiple sclerosis or bipolar disorder. So the number of psychotherapies are available. Then there are family therapy techniques which are available for those individuals who are having a lot of family issues and risk factors, and where there is a substance use in family as well. Then there are a number of social therapies which focus on the social skill training. Then there is a network therapy which actually focuses on uh, different networks of the patient, and the work is done to help the patient to quit substance use using the network. Then there are self-help groups like Alcoholic Anonymous or Narcotic Anonymous. This self-help group help actually patient to quit substance use by using with the help of the peer support. Okay, so that can also help the patient to quit, and that is also found to be effective. So there are a number of range of therapies and techniques are available, and these are depends upon the patient profile, and we have to actually give the client-centric treatment, and we have to be also cautious about not forcing any treatment or not coercing treatment, but take patient into the confidence and having the alliance and partnership where the best possible treatment could be delivered for the best outcome.
Right. So, you touched upon, when we talk about the biosocial psycho aspect of addiction as well as addiction related treatment, you spoke about the role of families and, family therapy as well. So can you throw a little bit of light on, what is the role of family and, loved ones when it comes to aiding recovery, especially in this case?
I think it is very, very important because India is, family-based system. So initially we had a lot of joint families, but now it's a nuclear family, and the interaction with the other family members, how is their attitude towards the patient, how is their support, it is very vital for the treatment of substance use disorders. What we have noticed in the clinical practice that many times there are a lot of myths associated with the substance use disorders among the family members. So then family members are likely to take patient to the faith healers, or they may actually have the negative attitude towards the patients. They may actually criticize the patient because they think patients are using it deliberately. So there could be even the physical abuse of the patients in many cases, or scolding or criticism, which lead to the vicious cycle. Because even if patient want to quit because of this criticism and negative attitude and behavior from the family member, then again patient thinks that why I should quit, because anyway this family members are not trusting me, and they are not supporting me. So then patient again go to the substance use, and then the cycle continues. So if the family members are supportive, and if we are able to include family member into treatment and we are able to psychoeducate them, then we see there is a significant changes in the treatment outcome, and also the patient's recovery. Because once the family members attitude is changed, that is quite obvious because patient is going to spend maximum time with the family members. They are with the clinician or therapist only for a few hours, right? Unless otherwise they are admitted in the rehab centers. But OPD based practice, they are only spending few hours. They are spending maximum time with the family members. So it is very important and vital to change their attitude and behaviors towards the substance use disorders and to bring them into treatment and psychoeducate them to address various myths and various misconceptions they have with the substance use disorders, and it is quite effective.
Right. So, Dr. Bhar, you touched upon a few of the myths and around, like even at the beginning that, we look at addiction as a choice, or we consider it to be a, sort of, like a punishment or a curse, or, like a personality flaw almost. And again, also coming to when we talk about treatment, that, families do believe that, you can take someone to faith healer or, give them those inhuman kind of treatments because they're struggling with addiction. So can you throw a little bit of light on, what are some myths around addiction and addiction-related treatment that you would like to call out?
Yes, so first thing is actually it is not a disease. It is not viewed as a disorder or disease or the brain problem, but it is something different. So that myth exists not only among the patients and family members, but also among many of the clinicians and doctors. And that is the reason actually many people don't want to deal with the addiction problem. They said it is sent to the rehab or something. So that is the thing. So it is very important to understand that it is a brain disorder, but it's a biopsychosocial problem. So it is not only the brain problem, but there is also psychological and social factors. So since it is a biopsychosocial problem, we have to give the biopsychosocial treatment. Both medication and counseling is important, and it is very effective if given the properly. So there could be also some cultural aspect as well to this problem, and this cultural aspect varies from region to region. For example, if you go to the some culture or some areas, it may be the part of the culture to take a substance. For example, if you go to Rajasthan, taking a film in a various culture, it is a cultural practice on various social function, or taking alcohol in Punjab, right? So, or taking cannabis on the occasion of Holi or Mahashivratri. So we have to also understand this aspect, and we have to also view addiction as a part of this practice as well. And understanding this can actually help us to understand it better and solve the problem better way. So that's the first myth. Second thing is there's no treatment available for the addiction. That is another myth, which is not true, because there are a lot of medications available, a lot of therapies are available, a lot of counseling techniques are available, and patients are bound to get better if given the proper treatment. Third thing is addiction is not curable, or it doesn't get treated. That is also many people think. So it is true that there could be the recurrences or relapse, but this is similar to any other chronic disorder. For example, if you see the patient with diabetes, they can also have a lot of relapse. Despite taking medication, they can have the increase in sugar level or decrease in sugar level, and you may have to adjust the medication. For example, in hypertension also you can have ups and down. Similarly, in addiction also, addictive disorders, there are ups and down. There could be relapse, but we have to identify the relapse and then treat, and then eventually patient will be off the drugs. So it may not be possible to quit drug in a one attempt. So for many patients it will take multiple attempts. So we must understand that, and we have to expect the relapse. For family members also it is very important. So that is the thing. Then another myth associated with the treatment or sending to rehab is the only solution. That is not true. That of course it helps in the acute care, but it is a chronic disorders and you have to take medication for a very long time. So we often advise patient to take medication for at least 1 year, but some patients they may have to take for the longer period of time, similar to any other chronic disorders. Okay, so that they may have to take for the longer period of time. So these are some of the myths I think I would like to highlight for the benefit of our audience.
So, Dr. Bhad, in terms of, like sort of countering these myths, what would be, some ways that, you believe that, we can make a difference to the attitudes around addiction and substance use, and how can we spread that awareness to, counter all these myths which are existing around addiction?
Yeah, I think we have to the we have to reduce the stigma around the substance use, and we have to also need to talk more often about the addiction problem, and we have to be open about that, because what happens usually that people say that someone is addict or that neighbor is addict, but they will never recognize that their own family member is using some drugs, or they won't admit. So addiction exists, but it is in others house because of the very significant stigma associated with that. So we have to start recognizing the problem. It is a very common problem. For example, tobacco use, if you see in India, every third person uses, adult person uses tobacco in some or other form, either in chewable or smoking form. So it is such a common problem. Alcohol, almost 15 to 20%. So that means every fifth adult person in India uses alcohol at least once in life, in a past 1 year. So it is very common problem. And gaming disorder and gambling disorder, we know now that how it is common because of the after COVID-19 pandemic. So the more often we talk, it will be help us to go for the help, to seek the help. That will also, we need to also use the language which is more neutral and not offensive. So calling somebody is like nashari, or of the loose character, it is not a good thing, because we don't call anybody suffering from diabetes that he's a loose character, or it's some madhumeha. If somebody is having, we don't use as a in that connotation. So when we are using in a language in a day-to-day conversation or in media or movie, we have to be careful, and we have to use the words which are neutral and not offensive, or not having the negative connotation. That will help to reduce the stigma, and that will help people to open up about the problem and come forward for the treatment. And treatment is available. It is a treatable problem. So nothing to be worried about, because medications are available, therapies are available. So problem can be solved. It is not something which cannot be treated, or that cannot be solved.
Right. You very rightly threw light around, not just the stigma, but what I was going to come to is around the language that we use around addiction. And we do use some very offensive terms, right? Not just in India, but also abroad, for people who take substances, who struggle with addiction in general. So how do you feel that language that we use, as well as, the stigma which prevails, can sort of deter people from seeking help?
Yeah, so that is because of their description and in the media, print media, or the medias, and this has come for a long time. So gradually it is going to go, but we have to work around that, because when talking about the addiction in the public fora, or during the depiction in the movies, or in the textbooks and the books, so we have to use the proper language. So that is going to take time, and everybody need to come together and solve this problem. Okay, so that will happen gradually. The one of the way to actually help to increase awareness or to reduce stigma would be actually some celebrities or some high influential people who are having the substance use problem, if they can forward and tell their stories, because we know that there are a lot of influential people, not only in the Bollywood but also in the political field or in music industry, or very renowned people. They have been suffering from addiction, and including just now Akram had told that he was suffering from cocaine addiction, cricket. So he has come up. So that actually helps in increasing awareness and coming up, opening up, and reducing the stigma. So he doesn't have now, he doesn't feel bad about telling about that or disclosing that I had a cocaine addiction. So similarly, if the influential people can come around and can increase awareness and can open up, and I would like to, cite example of Deepika Padukone also, Bollywood actress. She spoken about depression, and we know that what was the impact of that. Because of that, many people now openly talk about depression, and they come for the treatment, and that has helped huge because of her huge, fan following. So we need a similar kind of movement for addiction as well.
No, and I think you're very right, in terms of the way the media portrays addiction, not just in news, but also in, fictional depictions of, what a typical person with an addiction looks like, or, just sort of demonizing rehab, or
Mm. Mm.
demonizing rehab centers, or showing how
Mm.
inhumane recovery is for people. I think,
Mm.
that also can be a huge deterrent to people to
Mm.
seek help, because firstly, in stigma, and not knowing whether this is treatable, am I always going to remain this way? But also when these are the sort of, depictions and portrayals that you see, it sort of reinforces that whole stigma. So I think, as you said, having more humane portrayals, having more stories and conversations around addiction can make a big difference. But you worked in both urban and rural settings, and you researched as well in terms of low middle income countries as well as developed countries. So have you seen any differences in way the conversations around addiction happen, or treatment for addiction is available?
Yeah, so the things are changing actually. There are a lot of changes which has happened, and it is gradually changing. So there's a lot of discussion happening in the media or in the portrayal in the movies as well. For example, there was a lot of discussion around addiction when the movie came, Urta Punjab. So there was a lot of discussion about the heroin addiction in Punjab that time, and strategies and panel discussion. So yeah, things are changing. There are increase in dialogue now, and people are able to understanding and discussing in a human way. So there are blogs now. There are stories where people are coming out and writing. Some are writing anonymously, or some are able to disclose their names and discussing their problems. And things are changing now. So I am very hopeful, and in future, I think we are likely to see much change environment for the people with substance use disorders. And yeah, I'm definitely hopeful.
So, Dr. Bhad, you spoke about change, and we've spoken about, how we can, just sort of recognize the signs that someone might be struggling. But for people who are watching this, who are not mental health professionals, how can they support someone who they know, or, in their family, or a loved one or a friend who they've seen who might be battling addiction?
Yeah, so single most important thing is actually having the attitude. So even if we start treating them just like how would we treat a person with the accident, or somebody suffering from the diabetes, or somebody having the headache, or asthma attack. So how would we react, and how would we support you? Would like to ask that whether they need any treatment, what is the problem, any support, whether they want to go to the doctors. So having such this kind of change in behaviors towards a person who is actually using alcohol or tobacco or opioids or any other drugs, cannabis, and talking to them, recognizing their problem, and just advising them to consult somebody or have the treatment or discuss any problem they have. So that simple steps can actually help, definitely, it will make a huge change. So just giving the support, and just giving the assurance and helping hand, and just directing them to the clinician or the counselor or psychotherapist who are trained to deal with such problems can make a huge difference. And I would actually advise our audience that if they come across any such person who's using substance or suffering from addiction, just try to talk to them, and assure them, and as a friend, and as you talk to any other person with the other medical chronic medical disorders. Yeah, that's it.
So, Dr. Bhar, just to wrap up everything that we've spoken about today, if you had any parting words for anyone who's watching or listening to this right now who might be having a hard time with their mental health, what would that be?
I would like to say that it is a problem. It's a very common problem, and no need to hide it. No need to suffer from it, because the treatment is available, which is very easy, which is accessible. It is available in most of the major cities nowadays. And government of India, state governments are also doing a lot of activities to increase the awareness and help. So there is a Nasha Mukti Abhiyan which is going on currently by government of India, under Ministry of Social Justice and Empowerment. So that under this abhiyan also, there are a lot of awareness activities and helplines about the counseling, which is available free of cost. Then there is a lot of centers which have been set up, which can give actually the treatment in different part of India. So the treatment is available. It's accessible now, much more than what it used to be. So come forward and take help, and no need to hide it actually. And it is a treatable problem like any other, uh, uh, any other medical problem. Okay.
Thank you so much, Dr. Bhar, for all your time and all your insights. I think, this conversation, I think is really going to help a lot of people to gain more awareness and insight, not just about addiction and the way we can, move on from looking at addiction merely as, a personality problem or, a flaw in character, but also more as a biosocial psycho problem and something which is actually a brain disorder and a mental health related condition. And lastly, for anyone who's, watching or listening to this, and if you're having a hard time with your mental health, even as, doctor said, there's always help available out there and there is hope. So you don't have to go through this alone and it will get better. So till next time, please stay well and stay healthy. Thank you.